I'm with Dr. Joseph Saba, the CEO of Axios, and Dr. Anne Reeler, the CTO of Axios. Hello.
Hello.
Um, what do you see as the primary changes in today's healthcare industry?
Oh, I think there are very large changes because the whole disease pattern is changing. It's changing in this region, it's changing in developing countries, it's changed already in Europe as well. There's a huge movement towards chronic diseases, so that requires a whole new set of healthcare interventions that require different training, different equipment, different systems from what we've seen until now.
There is also an increase in cost of healthcare in US and Europe, and it's really an inflationary healthcare. And when you look at emerging countries and like in the Middle East, where they are still building this healthcare system, there are lessons to be learned also from what happened in the rest of the world.
How is this affecting patients' access to healthcare in the Middle East?
Well, I think that there are multiple issues here. I think the cities have extremely good healthcare systems, very high level, very fine systems. But I think that there is issues around access in rural areas where there's not so much healthcare infrastructure. And in addition to that, I think the whole concept of chronic disease management requires an involvement from the primary healthcare level, so you can actually follow up on patients, help them with their lifestyle diseases. So it's not done just out of the big tertiary care hospitals, the sophisticated hospitals. You need that primary healthcare involvement to help people change their lifestyle.
When we go to emerging countries, including in the Middle East, you find that there are many patients who cannot pay for healthcare, and the government doesn't necessarily reimburse. And these patients, sometimes they get charities. Uh, but you have a very large proportion of patients who are not poor enough to get the charities and not rich enough to be able to afford healthcare. So there is a big gap that is actually increasing because the demand with chronic diseases is increasing, in many of these countries, and we really need innovative solutions to be able to address the segment of the population that is not able to get, access to drugs and to healthcare.
What are some of the innovations your organization is bringing to healthcare?
Well, I think we've had a lot of experiences with, trying to improve healthcare systems by involving communities, having community support mechanisms, so that when you have a chronic disease patient, it's not just in the health center or the hospital that it takes place. There's also a social support system outside that helps this patient remember his medications, go for checkup, and talk to him when he's feeling bad about his disease. And that's some of the things that we have worked with healthcare systems in other countries.
Yes, we also have an innovative approach. We call it creative access strategies. But the idea is to address this middle segment that is not rich enough to afford the medicine and not poor enough to get actually donations. And for these, we have established system where people can pay what they can afford and at the same time get the care that they need. So basically, it works like a social security system where the people who can pay more will subsidize the people who can pay less. But in the end, you have everybody who has access to these drugs, especially when it gets to innovative drugs like cancer drugs or drugs that are sometimes very expensive for not only the patient but the whole family.
Is quality a concern with a system like that, or everybody's getting a good quality healthcare for the same contribution?
That is the precondition, is that you get the quality. Actually, the quality increases because these kind of programs require follow-up of patients. So we follow the patient and we make sure that they get their drugs, that they get what they need. So actually, the quality is usually excellent for the patients, and they all like it.
How can we overcome the access challenges?
Well, I think we need to look at new partnerships. We need to look at how can health systems, governments partner with schools, with communities to get that social involvement that is now so important in the chronic disease prevention and management. So I think we really need to look at these partnerships, including with the pharmaceutical industry, which, as Joseph says, has sometimes very highly priced drugs. These kinds of partnerships will find new solutions, and then we need to have very good data collection systems so we can actually measure the impact of what we're doing and learn from it.
When I did my medical studies, I was a medical doctor, and I was supposed to drive the prescription and healthcare. And also, when I started working, it was supposed to be the government responsibility to handle healthcare. Today, we know that this cannot work forever like that, and that you need the multi-sectoral approach where, you know, the patients, the civil society, the insurance companies, everybody needs to get together to really to find one unique solution.
And what do you hope to learn or teach at a conference like this?
Well, I mean, I'm learning every day, and it's interesting hearing about all the experiences from other sides of the world and from this region in particular. Teaching, I'm talking about some of these community involvement aspects and one of the sessions tomorrow. So maybe some of the lessons learned that we've had with the chronic disease management and the social aspects of how you support that would be relevant for some of the things that are needed in this region.
There is also, I mean, all these governments in the Middle East are building their healthcare systems. So I think we have a message here to bring about how the multi-sectoral approach needs to be done, so that we don't repeat the same, I would say, mistakes that were done in US and Europe.
And what do you consider to be the next generation of access solutions, and how are these solutions different than what is being used today?
Well, I think some of the access models that Joseph spoke about the cost of the treatment, you know, a new generation of access that is very viable in this region and elsewhere. And I think, you know, the whole aspect of the taking into account the social aspects of the disease, the families, the communities, we need that. With the chronic diseases, there's no way we can do it without it. And I think that's the new thing that's coming.
Yes, I think the tendency is to start looking at tailored solution to individual patients or groups of patients. I think the idea that we all grew up with, where you have one disease and one drug for everybody, is now the whole concept is changing. We know that there are genetic variations that we need to address in some of the treatments. So the treatment is coming much more sophisticated and much more tailor-made to groups of patients, and I think also the delivery of healthcare can follow the same path. So I think, you know, we're really seeing a complete shift from what used to happen 10 to or 20 years ago.
What are the benefits of these new access solutions?
Well, more patients get relevant treatment, and you know, it improves their quality of life and their disease prognosis. And I mean, that's the benefit. I also think that we learn a lot in terms of the health system as we do these new models. We learn a lot that will allow us to improve even further.
Yes, I think the relevance of the treatment, the relevance of healthcare to individual patients is becoming more and more as something that both science is doing, but also the society is trying to get to.
Dr. Saba, Dr. Anne Reeler, thank you very much. It was a pleasure talking to you.
Thank you.
Thank you.
Thank you.
Pleasure.